Welcome to Section 4 of Chapter 2, Analyzing Risk in Contracting.
So we've talked about risk a couple of times in this chapter. Let's talk more about it. Insurance companies are in the business of taking risk, whether it's your homeowner's insurance, car insurance, or health insurance. In some contracting, there is a transfer of risk. There may be a conversation about you taking, as a provider, you taking on some of that risk that the health plan accepts. Those are called risk contracts. There's upside risk and downside risk. Upside risk is when you're paid for savings. There's no downside to you. You're only paid when they save money. Downside risk is when you may be in a situation where you're actually really at risk, where you're going to actually have to pay money back if you don't meet your target, if you don't meet the budget. Those kinds of relationships are rare to a single practice, incredibly rare unless you have an enormous practice. Those relationships are where you need a lot of members, sometimes 5,000, 10,000 members in order to have a risk relationship. The benefits, as you take on more risk, the benefits are higher. You may get paid extremely well, but you're at risk for that overall cost. And a downside risk contract, again, typically with a very large number of lives so as to spread out that risk, you're in a situation where you have a budget that you're going to meet. If you meet the budget and beat the budget, you're going to get savings. You're going to get a piece of that premium dollar. The downside to it is if you don't beat it, or suddenly you have a cost spike, or you unfortunately have a really sick patient that ends up spending a lot of money, that you might be in a situation where you frankly could actually have to pay money back to the health plan. Again, typically it's not done with a single practice. In fact, very rarely is it done with a single practice. It's done with a group of practices over a large population. In risk contracting, again, you're typically part of a bigger group, and there needs to be an analysis of that risk. How much you're taking on, is the population large enough to make sense for taking on that risk? The great thing about what you're doing is in that integration of behavioral health into the medical services of your practice is that, again, you're going to get in front of some of those chronic conditions. And I know you know this better than I do. Get in front of those chronic conditions, keeping patients from high-cost providers, emergency rooms, inpatient stays, stuff like that. You're going to get in front of those problems before they become big problems that are very expensive. Your value as a primary care physician that has integrated behavioral health is really to those risk-taking groups. You might want to be part of one of those larger clinically integrated networks offering those services, because it's a great way for those clinically integrated networks to mitigate their risk, get paid better as an organization, and it's something that you can share in. So your contract might be with the clinically integrated network as opposed to directly with the health plan. So in a risk environment, you really want to use those data aggregation tools. You really want to see what your costs are per member per month. You're going to want to use those tools to identify those patients that are at the top of the pyramid, the ones that there may be very few of them, but they cost the most money. Use those tools to find out, why do they cost the most money? Is it because they're hot spotters where they go to the ER a lot? Is there a way you can work with your network of providers, work with the emergency room to identify what is it that's driving those patients to the ER, just as an example? It may be a chronic condition. It may be that the patient is not aware of other services that are available. That might be a patient that you're not going to want to wait to come in to see you, but you actually go get them and really encourage them to come into your practice. Use that integration of behavioral health and medical services to really get on top of what this patient's issues are, try to lower their overall costs, do all of those quality measures Make sure that they're getting everything that they need. They get the medication that they need. They're having all the proper tests so that you can get on top of and lower that overall cost.
One more thing about risk. Risk exists in every contract, even in a fee-for-service contract. It is important to keep this in mind when looking at your own costs to make sure you are being reimbursed appropriately for the services you provide.